Hello and welcome to another interview here at EULA 2026 in London. My name is Mikael Boesen. I'm a patient representative from Austria with EULA PARE. And I'm delighted to be joined here by Professor Oliver Hendricks. Professor Hendricks is a clinical professor of rheumatology at the University Hospital in Esbjerg and also head of research. Thank you very much for joining us today.
Thank you.
You have just come out of a session talking about digitalization in rheumatology, and you have the very intriguing title of The Dark Side of Digitalization. So I'm very excited to know about what you mean by the dark side of digitalization, please.
First of all, thank you for giving me this scene. And we might start by saying digitalization is right now understood as a communicational issue. And maybe when talking about negative sides of digitalization, people have in mind that there are some mental issues, cognitive impairment due to the huge amount of information that is produced and also an issue that is to be covered by us professionals. But what is completely overlooked is the impact of digitalization on the human body. What I mean by saying this is that I now see young adults being affected by thumb osteoarthritis because of using the device. I see 25-year-old people, because they have used their mobile phones since they were 10 or 12 years old, having an impact on their posture. So we have to understand that digitalization results into a micro adjustment of how we use our body in everyday life. And it doesn't stop there. Maybe my most important metaphor is that in Germany, they now are about to put the traffic lights into the tarmac because people get into traffic accidents by looking into their mobile phone, and coming out of the railway station, they would run into a tram. So it's not only an impact on how our body is changed by the technique, but also already a change in our environment due to the technique. And I think that is very important when we consider RMD as something that is concerning our human body. So headline number one, digitalization does not only affect our mindset, but in a very intense way also our physical integrity. So saying that, it's also interesting to look at how are we approached by the technique. So of course, there are a lot of wonderful advantages due to the technique. And we can look at all the teleportals that make things easier for the patients. Marvelous. We can have a look at that. The way how we receive a lot of relevant data is much more fast, much more elegant. And all this is good. But we also have not only to look at the bright side, we also have to look at the shadow side. So when taking a look at that as a professional, I'm sometimes overwhelmed because it is so much data that I can't follow up. So there is now this focus on cognitive impairment, because are we human brains able to digest all the information that is performed? Another aspect is that when looking at the competing different programs, we are challenged to choose which one are the most relevant ones. And there has been performed a very nice study 2 years ago that showed that the digital solutions in the healthcare sector are not primarily introduced by doctors, not by the patients, not even by the hospital directors. It's primarily industry or political engagement, which results that both healthcare professionals and patients are represented by the programs that exist. And that is, of course, a problem, because do we really have the solutions that are the best ones and the most relevant ones? It also has an important philosophical aspect. Digitalization, the word is derived from the word digitus, which means finger. But it was in the English language converted into the word digit, which means numbers. But the heartbeat of the algorithm is based not on 10 numbers, but only on 2. So it is actually a mathematical binarization. So when using the system, we also have to be very much aware that when we are dealing with data that are in the very essence of the data, binary data, it's wonderful, especially when we have a lot of these data, because then the form in which it is converted fits perfectly. The more creative we human beings are, and the more the data relate to rare diseases, the more tricky it gets. So we also have to be very carefully, is the fact that is presented to us really a mirror of the truth? There's a very old communicational metaphor for this. Data is always only a map. It is not the landscape. So as long as we accept that data is the map, we're doing fine. When we kind of think it is the truth and it's an absolute truth, we make a mistake. So it has been very nicely said, stay as the professional, the pilot, make the digitalization and the AI your co-pilot, and then you're doing good.
That's all amazing and a lot to take in. And can I talk to you about what you said at the very start, though, when we talk about our children and how they use these digital tools and what it does to their body. So what kind of solutions would we have to that? Like, what would we have to do to combat that? Like, I guess from a very early age, because children probably use tablets now from the age of like 2-3 years old in some cases. So what needs to happen to work against this and get away from it a little bit and make sure that our bodies are not going the way you're telling us that they're going?
I think first of all we have to realize that it is not going to disappear, and to be very clear about what we have to live by ourselves as good examples for the kids. Children can't expect that they are supposed to do something different if they experience that their parents constantly in their time at home sit in front of their laptop or their TV. And this is maybe my most important advice: be the good example yourself. I love this part of the English language where we call it somebody or everybody. It relates to the body. In the same way, you can say nobody is now entering a completely different meaning of the world, of the word. You might say we are entering a world of nobodiness if our children not any longer are engaging in activities where they really use their body. And so I would say you can't say to your kid, no, you're not allowed to use the mobile phone, but you have to address, hey, now we should go out and play football. Now while we are eating. So it's also a focus on the ability of multitasking that has to be adjusted in a way so to remember your bodily activity is a task that we shall live in daily life.
That's great. That's a really, really good advice. Thank you so much for joining us today and giving us this insight, and probably also a bit of a wake-up call, I have to say. So thank you very much.
My pleasure. Thank you.
That's us at the end of the interview. Thank you very much for watching. We're here at EULA 2026 in London. Thank you.